Have you ever experienced a sharp pain in your lower back or side that left you curled up in agony? Or maybe you've noticed some unsettling changes in your urine, like blood or unusual frequency. These could be signs that kidney stones are forming, a condition that impacts millions each year. What if you could prevent them before they cause severe damage, or know exactly how to deal with them once they strike? In this guide, we'll dive deep into the prevention, symptoms, and most effective treatments for kidney stones, knowledge that could save you from a world of pain. Stick around to discover key lifestyle changes that make all the difference and the critical warning signs you should never ignore. What are kidney stones and how do they form? Kidney stones, also known as renal calculi, form when certain substances in the urine become highly concentrated, leading to crystallization. Common minerals involved include calcium, oxalate, and uric acid. These crystals can gradually grow larger, eventually forming stones that obstruct the kidney's drainage system. For instance, people who consume too much salt or lack proper hydration are at a higher risk of forming stones due to excess calcium and other minerals being present in the urine. When kidney stones form, they often start small, but if left unchecked, they can grow large enough to block the urinary tract. A blocked urinary tract can lead to intense pain and other complications, including infections or damage to kidney tissues. Understanding the formation process helps in taking early preventive measures, like monitoring your diet and staying well hydrated. Even minor changes in lifestyle can significantly reduce the risk of stone formation. One important factor in the formation of kidney stones is dehydration. When a person doesn't drink enough water, urine becomes more concentrated, increasing the likelihood of mineral crystallization. To reduce this risk, health professionals often recommend consuming at least 8 glasses of water a day and avoiding beverages high in sugar and caffeine, which can further dehydrate the body and contribute to the problem. Common symptoms of kidney stones. One of the most common early symptoms of kidney stones is sharp pain, often referred to as renal colic. This pain typically starts in the lower back or side and can radiate to the lower abdomen and groin as the stone moves through the urinary tract. The intensity of the pain can fluctuate but is often severe enough to require medical attention. It's important to recognize this pain as a possible sign of kidney stones, especially if it comes on suddenly and with no clear cause. Alongside pain, other symptoms of kidney stones include changes in urination. You may notice an increase in the urge to urinate, but with only small amounts of urine being passed. Blood in the urine, known as hematuria, is another red flag. This happens because the stones can scratch the lining of the urinary tract as they move, causing irritation and bleeding. Urine may appear pink, red, or brown as a result. Nausea and vomiting are also common symptoms when kidney stones cause blockage or severe pain. This occurs because the body reacts to the intense discomfort in the kidneys, and the digestive system can become affected as well. If any of these symptoms arise, especially in combination, it's important to consult a healthcare provider promptly. Early detection can lead to more effective treatment and prevention of complications. Effective ways to prevent kidney stones. One of the most effective ways to prevent kidney stones is by staying hydrated. Drinking plenty of water helps dilute the substances in urine that form stones, like calcium, oxalate, and uric acid. Aim for at least 8 to 10 glasses of water per day, and even more if you live in a hot climate or exercise frequently. When your urine is light and clear, it's a sign you're staying well hydrated and reducing your risk of stone formation. Another key prevention method is to limit your sodium intake. A diet high in salt can increase calcium in your urine, which can lead to kidney stones. Reducing processed foods, salty snacks, and adding less salt to meals can make a significant difference. You should also be mindful of hidden salts in packaged and restaurant foods, which often contain high levels of sodium. Managing your protein intake is another important step. While protein is an essential part of a balanced diet, consuming too much, particularly from animal sources like red meat and shellfish, can raise uric acid levels and increase the risk of kidney stones. By balancing your intake of protein and choosing plant-based sources, such as beans or lentils, you can protect your kidneys and support overall health. How diet impacts kidney stone risk. Your diet plays a significant role in determining your risk of developing kidney stones. Foods high in oxalates, such as spinach, beets, and nuts, can contribute to stone formation, particularly when consumed in large amounts. While these foods are nutritious, It's important to balance your intake by pairing them with calcium-rich foods, which can help reduce oxalate absorption in the digestive tract. For example, adding dairy products or fortified alternatives to your meals can help minimize the risk of stones. Calcium itself, however, needs to be consumed in moderation. While calcium is crucial for bone health, too much of it, especially from supplements, can lead to kidney stones. It's best to get your calcium from dietary sources, such as low-fat dairy products or green leafy vegetables, as these provide a more balanced intake. If supplements are necessary, it's essential to consult with a healthcare provider to ensure you're taking the right amount. In addition to calcium and oxalates, limiting your intake of sodium and reducing high-protein foods, particularly from animal sources, can further lower your risk. Excessive sodium increases calcium in the urine, while high animal protein intake raises uric acid levels, both of which can contribute to stone formation. A diet rich in fruits, vegetables, and whole grains, along with adequate hydration, supports kidney health and minimizes the likelihood of developing stones. Types of kidney stones and their treatment options. Kidney stones come in various forms, and understanding the type you have is key to choosing the most effective treatment. The most common type is calcium stones, which form when excess calcium combines with oxalates or phosphates in the kidneys. These stones often require increased hydration and dietary changes to limit calcium or oxalate-rich foods, as well as medications to regulate calcium absorption. Uric acid stones are another type, typically developing in people with high levels of uric acid in their blood, often due to a diet rich in animal proteins like red meat or shellfish. Treatment for uric acid stones often involves medications that alkalize the urine, reducing acid levels. Alongside this, adopting a low-purine diet and increasing hydration can help prevent further stone formation. For more complex cases, such as struvite stones, often linked to infections, and cystine stones, which form due to a genetic disorder, treatment can include a combination of antibiotics for infection, medications to dissolve the stones, or even surgery. Preventative strategies, like maintaining good hydration and adjusting your diet, are crucial across all types of stones to reduce the risk of recurrence. Non-invasive treatments for kidney stones. For many individuals, non-invasive treatments are the first line of defense when dealing with kidney stones. One of the most common recommendations is simply increasing fluid intake. Drinking plenty of water helps flush out smaller stones through urination, reducing the need for more aggressive treatments. Herbal teas and citrus juices, such as lemon water, are also advised as they may help dissolve certain types of stones. In some cases, medications are prescribed to help the body pass stones more easily. Alpha blockers, for example, can relax the muscles in the ureter, making it easier for the stone to pass. Pain relievers may also be necessary, as passing a stone can be a painful process. Alongside these, diuretics are sometimes used to increase urine production and reduce the risk of stone formation in the future. A more advanced non-invasive option is extracorporeal shockwave lithotripsy, ESWL. This procedure uses high-energy shock waves to break the kidney stones into smaller pieces, allowing them to pass more easily through the urinary tract. ESWL is commonly used for stones that are too large to pass on their own but do not yet require surgery. It's a straightforward procedure, typically performed on an outpatient basis, and has proven effective for many patients. When surgery becomes necessary for kidney stones. Surgery becomes necessary when kidney stones are too large, painful, or dangerous to pass naturally or through non-invasive treatments. Stones larger than 5 millimeters often require surgical intervention, as they may obstruct the urinary tract, causing severe pain, infection, or even kidney damage. In these cases, it's essential to act quickly to prevent further complications. One common surgical method is ureteroscopy, where a thin, flexible scope is inserted into the urinary tract to locate and remove the stone. For larger stones, the ureteroscope may also be equipped with a laser to break the stone into smaller fragments. This procedure is minimally invasive and usually has a quick recovery time, making it a preferred option for stones that are accessible but too large to pass on their own. For more complex cases, percutaneous nephrolithotomy, PCNL, may be necessary. This is a more involved surgery, requiring a small incision in the back to directly access and remove the kidney stone. PCNL is typically reserved for stones that are very large or located in a difficult-to-reach area. While recovery time may be longer, it's often the most effective option for those with recurrent or particularly large stones. Now that you understand the signs, prevention tips, and treatment options for kidney stones, it's time to take action. Are you ready to adopt healthier habits and lower your risk of these painful stones? Whether it's drinking more water, adjusting your diet, or staying vigilant about your symptoms, small changes can have a massive impact on your kidney health. And if kidney stones do occur, knowing the right treatment options can save you from unnecessary suffering. Let me know in the comments what steps you're taking to protect your kidneys, and don't forget to hit subscribe and turn on notifications to stay updated with more health tips like these. Your kidneys will thank you.